Personnel from the medical corps of the army are being deployed to alleviate pressure on frontline health workers buckling under sheer volumes of patients, as the wave of cases predicted weeks ago expected to arrive in the next 7 to 14-day window.
We all know that we have to reach a certain point, and that point is going to be a horrific point in terms of death, but it's also a point at which things are going to start changing. We're getting very close to that level right now, and the next week and a half, 2 weeks are going to be, I think they're going to be very difficult. At the same time, we understand what they represent and what that time represents, and hopefully we can get this over with, because this is a very horrible thing for the world.
The complaints from local officials and health practitioners have been consistent for weeks. As protective gear is replenished, so too they're quickly depleted. And despite improvements in bed capacity in places like New York, projection models indicate that there are just not enough ventilators to go around.
I hope we're somewhere near the apex, right? Or we're somewhere near the plateau. So I would hope that we don't need anywhere near that number of beds. That's the good news. The bad news is the number of beds doesn't really matter anymore. We have the beds, it's the ventilators, and then it's the staff. That's the problem.
Obviously, we are the epicenter of this crisis. So I would certainly appeal to both the federal and state government to help us get the ventilators we need rapidly.
With an eye on European hotspots that have begun to see a downward trend in the number of cases and deaths, a sliver of optimism that the US too could begin to plateau in the not-too-distant future.
We're very hopeful that over the next week, although we'll see rising number of cases of people who lose their lives to this illness, we're also hopeful to see a stabilization of cases across these large metro areas where the outbreak began several weeks ago.
This as a tiger at the Bronx Zoo in the city tested positive for COVID-19 in what is known to be the first case of human-to-animal transmission, making the animal sick.
We assume it was one of the people who took care of her. We have not had any employees working around the animals who are sick because, of course, we have strict policies about not having people sick work around the animals for the health and safety of the animals. So there's no one who was sick who worked with them. But with the number of infected people in New York City, it's very easy that someone didn't know they were infected and were shedding, or mildly infected, or went on to get sick later. But nobody associated with the cats has been test positive yet.
COVID-19 affecting all colors and stripes. Shervin Briceby's SABC News, New York.